This first one's pretty interesting. Actually, got asked to do a media interview about this one with Ken Brew in Cincinnati. And this is basically a segment about, are you too old to have plastic surgery, or how old is too old to have plastic surgery? And
an AI image.
How'd you know? It looks good, doesn't it?
I just assume.
All right, so not to
what did you put in?
Not
like
to derail the
old
segment.
Person?
I've changed. When I want to do images now, I use Grok. Elon Musk AI. It makes way better AI images than ChatGPT does. So that's the Grok image. I thought it looked like a picture though.
Yeah, it does look like a real person.
Have they gotten the hands better?
Yes.
Yeah.
Grok has.
It was like hands were like on
it
top
like
of
6
me.
feet. It looked like somebody came out of Chernobyl or something with like 6 fingers. But yeah, I've been using Grok's AI to make photos because it makes really good photos. So anyway, sorry not to derail our segment right off the bat. But yeah, so there was an article that came out this week, and I think I posted a picture of that article there. Charles, can you throw that up? Yeah. So this is from New York Post, talking about grandma makeovers, and of course, stuff hits like this, and people will ask me about it. And I guess the first thing that is to be asked is, are older people, and so older in this category would be like 60 plus. Are 60-year-olds and older
like
really
retired ages?
Yeah, tired. Oh, retired. Yeah, I thought you said tired. I'm going to definitely be tired.
That would have been rude if I said that.
So, retired people, are they getting more plastic surgery? And, the answer to that question is yes. There's actually a lot of studies written about this, and the age groups are getting plastic surgery. And so there was a study from the American Society of Plastic Surgeons that came out in 2018, and it looked at the previous 8 years, so from 2010 to 2018, and there was almost a 30% increase. It was like 28 or 29% increase in the number of people 60 and older getting plastic surgery, which
it makes sense because people are living longer, so it's like they want to look good longer. So.
Totally, and so that brings up the question of why, why is there this big boost? And you're exactly right. I mean, that's the first thing that I said is people are living longer and they're being more active longer.
Healthy.
Yeah, they're more healthy, and when you have these people who, they might be 60, they might be 70, and they don't feel old, and they're out there, being social and going out. And, there's so much pressure from society, especially on women, about, looking youthful. I mean, we've talked about that in the past. And so it's not surprising that they're getting plastic surgery. And then also the other thing, too, that sometimes people don't think about, and I've literally had people tell me this when they've come in for consults for plastic surgery, is like staying youthful because of work. There's definitely like this ageism thing that is out there. In fact, there was that big lawsuit against Google for exactly that, where people that are older or that are perceived as being older don't get as many promotions and have disadvantages in the workplace.
Shoot, sometimes I feel like my appearance hurts sometimes with like career stuff. Because people think I'm so young, so they don't take me very seriously. But I'm actually their age kind of situation.
Yeah, you do look pretty young. I had that too when I first, especially like when I was a resident doctor, because I feel like I look younger than my age, and that was especially true when I was in my 20s and I was like a resident surgeon, and people were like, "You're a doctor?" I'm like, "Yeah." I still every once in a while get people say stuff like, "Oh, you look so young."
It was pretty difficult running my store sometimes because they thought I was a college student, and then I'd be like, "No, I own this store."
This is my store. So the next question that comes up when you talk about older people getting plastic surgeries, is it safe? I think a lot of people
going under at that age.
Going under anesthesia.
Yeah.
And so, just to get right to it, yes, it actually is very safe, and there's been a lot of studies. I think I got one. If somebody wants to look at this study, throw it up there. Yeah, this is from the American Society of Plastic Surgeons as well, reporting on the cosmetic procedures, and that it was just as safe for elderly people as it was for young people.
They have to be healthy to go under just like a younger person would.
Right, and the only thing I would say about like safety and age is that, there is the tendency for older people to be more likely to have other health issues. And so, when I get someone your age coming into my office, I mean, we do the briefest of brief, like medical history. So like, do you have any big problems going on or anything like that? Or, what's your medication list? But like older people, I get a lot more specific. Like, have you ever had any issues with your heart, with your lungs? Can you walk up a flight of stairs, so on and so forth.
Yeah.
But given all things being equal, meaning if, an older person, say 60, 70 years old or even older, if they don't have those medical conditions, then really there's no increased risk for them having surgery. And then a lot of times, at least some of the studies showed that the elderly people actually had better outcomes, that they were actually a little bit healthier than some of the younger people. The only exception to that, there was one study out there that said that elderly people that get tummy tucks are a little bit more prone to complications.
I could see that. I remember when my grandma started getting older, like she would get skin infections so easily.
That's
like her skin.
I wouldn't say that that's like a normal thing for elderly people.
I don't know.
Yeah, it might have just been her.
Skin
I mean, she may have had like some underlying thing.
Yeah.
I do tons of tummy tucks. I average about one per week in my practice, and I do plenty on older people. I was trying to remember the oldest person I've ever done a tummy tuck on. I know it was in the 70s, and I think it was like older than 75. I personally haven't found them to do any worse than young people.
Yeah, the only thing I could see, I guess maybe just from like assuming, is just like older people have like their skin's not as like
right.
It doesn't snap back as easily. It's more
and so you're 100% right. And so like I wouldn't say that would necessarily cause complications, but it can affect the quality of the outcome.
Yeah.
Because for example, like when you're doing a tummy tuck or really any surgery where you're pulling skin tight, like if you have good quality skin, like it's going to hold that tightness better than if your skin is like older and more stretched out. And so you'll see a lot more kind of rebound, relaxation in people with older skin.
So like like their skin heals just as good as.
Typically, yeah. I mean, I would say that, yeah. I mean, like I said, as long as they don't have like underlying issues or on a bunch of medications, things like steroids that affect healing, then yeah, I mean, they do as well. And so, the next thing that kind of comes up is, so what procedures are these older people having? And there's two obvious ones that really are just kind of procedures for older people, is facelift and neck lift, which I kind of count that as one because we almost always do them together, facelift and neck lift, and then eyelids.
Because the extra skin.
Extra skin in the eyelids. So those are the obvious ones, but surprisingly, older people are having other surgeries as well. A lot of breast surgery. One thing that older people are, or one of the reasons that I see a fair number of older people in my practice is people who have breast implants, because breast implants don't last a lifetime, and a lot of people say if they got implants at your age, fast forward 30 years and suddenly they need to be replaced because maybe one ruptured. And so I get a steady stream, and I usually see at least a couple consults a week for people who are older who are getting implants either taken out because they don't want them anymore, or they've had them for so long that they just need to be changed or downsized or whatever. So you do see a lot of breast surgery, and then even breast reductions. A lot of women maybe wanted a breast reduction their whole life but weren't in a place where they could get it, and they get a little bit older, get a little bit more time on their hands. And then
every time you talk about going to get your boob job redone, I'm like, oh, I dread doing that again.
Oh, really?
Yeah, I'm like, I don't want to do a surgery again.
Dude, exchanges are so much easier. Like I do them literally all the time. I think I did 2 this week, and like patients sail to it because like all the hard work's done. As long as you don't have like a bad problem that we have to correct. Like swapping out implants, even if you want to like change size, go up, go down, like it's a breeze.
Oh.
Really. Like
it still makes me nervous.
Oh, well, if you need it, I know a good plastic surgeon. And then, the other thing we're seeing a lot of these days are like things like tummy tuck and body contouring, which would be arm lifts and leg lifts. And you know why? Because it's so easy for people to lose weight these days. Yeah. They're either getting weight loss surgery or semaglutide. And so we are seeing a lot of people come in for body contouring, and a lot of them are older patients. So yeah, it's an interesting article. I mean, to me, it's kind of like everyone knows that, but really, in reality, people don't know, I guess, that a lot of older people. I see it in my practice every day.
I think they think more of like old Hollywood it's like that's like a old rich person thing.
Yeah,
not like a normal.
It's funny you mentioned that because one of the articles that was talking about this even stated that exact thing, that in the past, older people getting plastic surgery was like actors and actresses. Yeah. And it wasn't something that like the average older person did. Yeah. And that's completely out the window.
Yeah, that's what I was thinking.
Yeah.
Because I'm like, Like whenever I think of like old Hollywood plastic surgery, I think of like Elizabeth Taylor.
Yeah, right. Yeah, right.
Like getting
yeah, totally.
Crazy surgery.
Back then, like there weren't near as many older people getting plastic surgery.
Yeah.
And
like how old is Madonna?
64, I think.
Yeah, she's retired age.
Yeah.
She's the tired age.
The tired age. Are you the tired age? But yeah, it is a common thing. Older people are getting plastic surgery, and it's kind of interesting to see some articles about it and then talk about it. So, all right, so just kind of recap this segment that we just were talking about here on Nip Talk, and it's about older people getting plastic surgery. There's some articles out saying that there are now grandma makeovers where older people like 60, 65 plus are getting tummy tucks and breast surgeries. I see this in my practice. It is happening. There's a lot of research papers out there that's showing that older people are getting more plastic surgery, a 30% increase over 8 years. The big question is it safe? And the answer is yes, it is safe. There are actually a lot of research papers out there looking at the complication rate between older people and younger people, and it's basically equivocal. Like there's no increased risk for older people. What surgeries are they having done? Facelift, neck lifts, eyelid surgeries, but also breast surgery. Implant exchanges or implant removals are very popular. And then with all the weight loss methods out there, whether it be surgery, Ozempic, or whatever, we're seeing a lot of body contouring, tummy tucks, arm lifts, thigh lifts, things like that. So yes, older people are getting plastic surgery, and it is safe. So
I will be an old plastic surgery person then.
Are you?
I guess. I guess because I have boobs. I have babies.
Yeah, well,
So
that's what a lot of people,
that.
Don't think about. That is like if you get breast implants, like you basically are.
You signed up for plastic surgery pretty much for like.
Yeah, well, at least
you
once
like
more.
Take them out.
At least once more.
Yeah.
Because unless you're getting, I do occasionally do augmentations for the first time on women that are, older. Like, trying to think with the oldest person I've ever done a primary augmentation, probably 60s. I'm not sure I've done 70-year-old. I know I've done body contouring stuff on them, and I know I've done exchanges, but like first time augs, probably 60s, which is kind of wild to think about, But then again, there's a lot of like 60-year-old women out there that, you probably would never guess they're that old, and they're out like going on vacation, going to the pool, like, doing all these things, and, they want to look good, and,
You gotta get those younger boys.
That's right. Cougars, right?
Yeah.